My presentation this morning is going to be on oral cancer, cosmetic dentistry, and some whitening. The topics I'm going to be covering on oral cancer are as follows. Statistics. Over 4,000 Canadians this year will develop some form of oral cancer. It's mainly a disease of the 40-plus age group, and men are at a higher risk than women, and Afro-Americans are also at a greater risk than Caucasians. Oral cancer is mostly found in people from the Philippines, South Asia, France, and Taiwan, and there's a reason behind that, and I'll get into that. The causes of oral cancer are multifold, but the main four causes are smoking. So when it comes to smoking and chewing tobacco, smoking, obviously, there's carcinogenic materials in there that can cause cancer. Chewing tobacco is a big no-no. You know, people chew tobacco, it's sitting in the gum tissue for hours and releasing materials that initiate cancer. Excessive alcohol. People never think drinking can cause oral cancer. If I was to ask a question, what do you think is excessive alcohol, in a week? How many drinks?
10.
Yeah. 10. Yeah, if you drink a glass of wine a day and maybe have a couple on the weekend, Friday or Saturday, actually excessive alcohol is 14 or more glasses a day. It doesn't matter if it's beer, wine, whatever, but excessive alcohol is implicated in oral cancer. The biggest cause nowadays cause of oral cancer is actually the human papillomavirus. Now there's 120 different strains of it, but the two really nasty ones that our body can't handle is strain 16 and 18, especially strain 16. Human papilloma strain 16 is what causes cervical cancer in women. And that's the same strain of virus that causes oral cancer. And the last thing that causes oral cancer is the sun as a result of the UV rays. The prognosis on oral cancer is very much dependent on the size of the lesion and if the lymph nodes are involved. So if the size of the lesion in the mouth is less than 4 centimeters and no lymph nodes are involved, the prognosis is very good. But if the size of the lesion is greater than 4 centimeters and the lymph nodes are involved, the prognosis drops drastically, down to almost 32%. So in other words, if you catch the cancer early, there's about a 92% chance of survival. If you catch it late, it's only about 37%. Okay? The types of cancer, 90% of all oral cancer is squamous cell carcinoma, and it's found mostly on the tongue. Where on the tongue? It's found actually on the middle third of your tongue, just underneath. So when you go to your medical doctor, he makes you go, he'll never see the cancer. You actually need to stick your tongue out and with a gauze have somebody turn it to be able to see it. So I hate to say this, but a lot of physicians miss it, will never see it. So 90% of all oral cancer is squamous cell, and it's found on the tongue. It is also found in the buccal vestibule, which means near the cheek area, in the cheek, and on the roof of the mouth. 90% of all skin cancer is basal cell carcinoma, and it's mostly found on the nose and lower lip. The signs and symptoms of oral cancer, there's about 6 of them. Persistent pain in the mouth, that's one. Slurred speech is another. Sores that don't heal, that last over 2 to 3 weeks. Difficulty swallowing, bleeding gums, and swollen lymph nodes. So those are cardinal signs of oral cancer. Persistent pain, sores that don't heal, difficulty swallowing, slurred speech, bleeding gums, and swollen lymph nodes. This is very interesting. Detection of oral cancer, when you go to the dentist, and I'm ashamed to say this, a lot of dentists don't even feel your lips, cheeks, roof of the mouth. They don't look at the tongue. You're in and out quickly. But detection of oral cancer has been usually visual and touch and feel. It presents itself as a reddish, raised lesion with a white border, and it's sometimes ulcerated. There is now an enhanced oral cancer screening device called the Velscope. The Velscope utilizes blue wave light spectrum technology, which causes the intraoral tissue in your mouth to fluoresce. In other words, it gets the cells in your mouth excited. Healthy tissue appears green in color in the mouth, and abnormal tissue appears dark. So the beauty of this product is that it picks up dysplastic cells, precancer cells, and cancer cells before it's visible to the eye. So the chance of survival or prognosis is very, very good. So what it does is that, again, early detection, the chance of survival is very, very good. There's also a test called the CDX brush test. So if you see anything abnormal in the mouth, you scrape it, you put it on the microscope, and you have a look at it. So those are the detections. The treatment of oral cancer has not changed for a long time. It's usually surgery, chemo, and radiation. The problem with oral cancer is it's very invasive. In other words, it will destroy. I've had some patients that I picked up cancer, or they came in for second opinions, and when they have surgery, it'll destroy your jaw, it'll destroy your tongue. I mean, generally speaking, if the cancer is found on the tongue or on the jaw, you're talking about an 18-hour operation between an ear and nose specialist and a plastic surgeon. You literally, half your tongue is gone, your jaw is gone. They have to take a rib and build your jaw. They have to take a thigh muscle and build your tongue. It's horrific. So again, early detection is the key. So squamous cell carcinoma is very invasive. And the sad thing about it is it's visible. It is not a pretty sight. And I'm going to show you some pictures. So you know, I can't see very well, but that's the tongue, that's the cheek area, that's the tonsil area. That's the right side of the tongue, and there's the I don't know if you can see it. Again, there's the tongue, that's the cheek area. That's the patient's left side, that's the molar teeth on the left side. There's the tongue, that's the roof of the mouth, there's the cheek, it's right at the back there. Sometimes people think it's a canker sore and it goes on and on and on. I can't tell you how many people have come in. The canker sores should not last more than 10, 12 days. You know, if your denture irritates the gums, remove the denture and the sore should go away. If it doesn't go away, that's kind of a sign that this is the patient's left side of the tongue, and there it is. It's a reddish raised lesion with a white border and sometimes ulcerated. Now, I have this product in my office. It's called the Velscope. And the beauty of the Velscope, again, it picks up dysplastic. What does dysplastic mean? It means cells that are changing in your mouth that can become cancerous or will become normal. It picks up change. It'll pick up precancerous cells and cancer cells before it's visible to the eye. So this particular lady had cancer just starting on her left side of the tongue. I could see it, and I know what to look for, but if you look at it there, with the Velscope, as I mentioned to you, normal tissue appears green, abnormal tissue appears dark in color. Not every dark lesion you see in the mouth is cancerous, but then there's other ways to differentiate. This is, of course, my thumb. Thumb is there, glove, gauze. You can barely see anything, but if you, again, the lights are on, but you'll see darkness here, and that's early picking it up. So the chance of survival for this person is very good. Any questions on oral cancer?
When you say survival, does it mean death or the destroying the face that you described earlier?
No, by survival, I mean the 5-year survival rate is very good. So if you pick it up early, and as I mentioned, if the lesion is, for example, less than 4 centimeters and lymph nodes are not involved, then the chance of survival is very, very good. But it's like any cancer. But the mouth, people will have bleeding gums, and they think that's normal, because they're used to it. You have a bleeding finger, you'll do something about it right away. So it's just
I heard it was something that we're supposed to wash our tongue or scrape it.
Yes.
Is that important?
Yes, scraping the tongue is a very good hygiene thing to do because bacteria sits on your tongue. It can cause other issues besides bad breath, but cleaning your tongue is a very, very good hygiene thing to do. Okay, so cosmetic dentistry. People talk about cosmetic dentistry and aesthetic dentistry, and there's a big difference. Cosmetic dentistry involves destroying one's natural tooth structure and replacing it with something that's more pleasing to the eyes, while as aesthetic dentistry, which is much harder to do, involves modifying somebody's natural tooth structure and replacing it with something that's more pleasing to the eye. So, for example, if somebody was to get a crown where you cut down a lot of the tooth, is cosmetic. You're cutting down a lot of the tooth, but doing a veneer, which involves removing only 0.5 millimeter and using your skills to get this very good result, that's aesthetic dentistry. So conservation of tooth structure is the key. When somebody comes in and they want to have some cosmetic work done, these are the criteria I look at. But the most important to me is actually the patient expectations. Sometimes people come and they think they're going to look 40 years younger, 30 years younger, and they're going to have a Hollywood smile and lifestyle. So I have to judge the patient's expectations. If they're beyond what I can deliver, I don't want to have problems with the patient. So I tell them maybe you should go somewhere else and get us another opinion because I know that patient's going to be a headache. They're thinking of what you can do is beyond what's capable. So now, when I design a smile, I try and incorporate 7 design principles in that smile. And these things don't mean anything to you, but what I'm going to do is I'm going to show you what these things, when incorporated in a smile, will look like. So if you look at a smile, so the first thing is, and it's very important, the most important thing about designing a smile is actually the size of the maxillary central incisor, the size of your front tooth. So how do you know what tooth suits you or you? They're all different. The way you do that is whatever the distance is from the bridge of your nose to the tip of your chin, whatever that distance is, 1/16 of that is the size of your front tooth, the length. Generally speaking, it's around 10 and 3/4 millimeters, 11 millimeters, generally speaking. So whatever the length is, suppose it's 10 for argument's sake, 10 millimeters, then the width would be 3/4 that, which is 7.5. So the size of the maxillary central incisor is the most important feature. When you see somebody smile, your eyes will always go right down to the middle first. You can have a beautiful smile everywhere else, but if those front 2 teeth don't look good, it's over. So the size of the maxillary central incisor is one feature that I try and incorporate in the smile. The second is embrasure space. You see that triangle right here where the 2 teeth come together? That's called embrasure space. So that space here if that space area is 1, this should be 2, 4, 8. In other words, it gets exponentially larger. You see that space here? It's bigger and bigger. So I try and create that space. The third thing is, where do the teeth come together? In other words, where is the contact? In the front teeth, the teeth should always come together near the tip. But as you go further back, the teeth will start to come together in the middle. Okay? And that's what gives you a certain type of shape. That's 1, 2, yeah. The fourth thing is that the gums on the patient's right side and the left side should be symmetrical. And I do that with my laser. So when a patient smiles, whether you can see the gums or not, the gums on this side should be symmetrical with this side. The gums cannot be overgrown and covering the tooth here and other places. You need to create gum tissue or gingival symmetry. The next is not just symmetry, but you have to make sure that the height of the gum tissue is done properly. So what do I mean by that? If you look at the lateral incisor, the smaller tooth, the height of the gum tissue should be right in the middle of the tooth. But on the central incisor, it's slightly skewed. It's slightly off to the side. And I do that if a patient's gum tissue is not right. I use a soft tissue laser to create that. So it's not just symmetry of right and left, but it's all the shape or silhouette of the gum tissue. The next thing is I always try and create a smile where the teeth are slightly tilted forward, not up and down, not going towards the back. They should be slightly tilted forward or mesial inclination. And the last thing I try and do is that the patient's lower lip should follow the contours of the tips of the upper teeth. The tips of the upper teeth should follow the lower lip line. So those are 7 design principles. Do I get all of them on every smile? No. But the goal is to try and do that. Go ahead.
First of all, I like your attention to detail. I'm just curious, so when you meet with a patient that maybe is going to be getting
Some work done.
all those things that you just talked about, do you discuss that with the patient?
I do, and I do. Actually, the next step will explain everything to you. So the next step is when I discuss that, and then if the patient says they're interested, what I do is what we call a mock-up. And a mock-up is something that's made out of wax that I show the patient before what they look like and what they could look like. And the design principles that I talked about, the 7, I try and incorporate it into the mock-up so that they can actually see what I did for them. And if they like the mock-up, then I'll do the work. So this actually is a medical doctor, and I'll tell you why he came to me with his problem. So as you can see, this is his models of his teeth before, and this is what I told him that I can make him look like. So he came to me with this smile. And what was his chief complaint? He said, I want to get this tooth and this tooth fixed. These are called congenital peg laterals. They're not shaped properly. So I said to him, Francis, you're happy with the rest of your teeth? He says, yeah. I said, do you like the color? He says, oh, they're quite yellow. I said, you like your front 2 teeth? He says, what's wrong with them? I said, one's short, one's long, and one's wider than the other. He never caught these things. So he says, okay, I agree. So then I said, okay, what needs to be done for you is you need to whiten your teeth first. Once you whiten them, you need to get 4 veneers done, and you'll look really good. So the mock-up I did was based on that. So you can see that the teeth and everything are exactly what you saw in the patient, you know. So that's what he looked like up close. That's what he looks like when he's smiling. Okay, now watch. You're not going to believe this. That's what he looks like now. So I whitened all his teeth and I did 4 veneers. Now try and see what I did. The gums are all symmetrical. The height is skewed. And all the principles that I was talking about, I created in that smile. Do I get it every time? No. Do I try? Yes. But if I get 5 out of 7, 4 out of 7, I'm happy. So look at him now.
How long will it last?
How long will that last? Every time I do work like this, I always have the patient wear a night guard so that everybody grinds to a greater or lesser extent. I've been practicing for 30 years. I've only had 2 veneers ever break, and one gentleman tried to open up beer bottles with it. And another one, this lady actually, I did her work, and then she decided to get braces on the bottom, and the orthodontist corrected her bottom teeth, but didn't correct it properly enough, so the bite on the bottom teeth was not harmonious with the top, and she chipped the tooth. And actually she went back to the orthodontist and had the orthodontist pay me to correct it, because what I did was fine. The orthodontist didn't talk to me and do things the way I would have done it. But
So all those principles that you just explained, like I'm in the last stages of Invisalign,
mhm.
and I never heard a lot of any of that, like, for example, when you're talking about the front teeth and
The height, the size, yeah.
Like, nobody ever said anything.
Well, the thing is, I'm not trying to be arrogant and all that stuff, but if you look up any Yellow Pages, internet, every dentist says family and cosmetic dentistry. Everyone says that. If you ever want to make a lot of money, you could sue every one of them because they don't have credentials. Very few people have taken the right, not weekend courses, you know, and if you go to my website, I've taken a postgraduate program at University of Buffalo in cosmetic dentistry. I've done laser dentistry certification. I've gone to University of Toronto to learn how to put people to sleep. So, you know, you can go to a physician and he says, I do cardiology, but he's not a cardiologist. I'm not a cosmetic dentist. There is no such thing as cosmetic dentist. There is no title to that. But you have to find people that do, and I'll show you some of the work that I've done. This is nothing, but it's how you feel. I mean, Nick's family comes to me, and that's how I met Nick, and what I did for Nick's wife, happy home, right?
Yep.
So this gentleman was a physician, and that's his before and after. Now look at this lady. This lady came to me. She had no self-esteem. She didn't even dress nicely. And when I finished her work, and this is God's truth, she said she got asked out a week later by 3 different guys. So she was, that's her, same person. That's her again, the right side. That's her left side. Now this is an interesting gentleman. He's from Poland. He's successful in the construction business, but this is what he looked like, spaces, and I created a nice look to him. This is a different person. He had a problem with, you know, too much space, and I did the veneers. I did 6 veneers there.
How long is a treatment like that?
It only took me 2 weeks. Yeah, it's done in 2 weeks. This was a very interesting case, and I don't expect you to pick this up, but actually this particular lady was missing her front tooth over here. And some dentist took this small tooth and put bonding material and made it bigger and a nice triangle. Like, this lady is a very attractive lady, and this is how she came to me. Anyway, what I did was something pretty interesting. I made this small tooth look like a front tooth. This tooth is actually this one. It's a bit of it's hard to explain, but bottom line is, look at her now. This is permanent. You know, you can see the difference. No braces, no nothing. I just went, in 2 weeks I made her look like that. Now this lady is a very interesting lady. You'll see her face, because I don't look at just teeth, I look at the face, and the face tells a lot. So you can see what she came in looking at, and she had missing teeth. Actually, I didn't take the pictures right in the beginning because I didn't think she was going to go through with the treatment. She has emphysema and other medical issues, and I prejudged her. Bad move. Anyway, I did an implant here, 2 implants there, and redid all her teeth, and this is what she looks like with veneers and all that. But here she goes. So that's her lower jaw. These are 2 implants, 1 implant here. I fixed everything up there. These 2 teeth I didn't do anything to. There's the implant crowns. That's an implant. And that's her lower jaw. And now look at her before and after. Now that's what I like, the face, because she never smiled. Look at her squinting. She always was like that. She was strained. And again, I don't tell people how to dress. Look at the way she's dressed now and feeling confident and so forth. So there she is before and after. While I'm here, let me just share something with you. Nick wanted me to just mention a couple things. You know, it's the marketplace. I don't make the rules. It's just the way it is. Good-looking people, doors will open. Good-looking people will get raises faster. Good-looking people get promoted. It doesn't keep the door open. You have to prove yourself. But the opportunity is there. And I'm giving you statistics. 100,000 male and 100,000 females in the States with the same socioeconomic background were asked, what attracts you to the opposite sex? 3 things. Tell us 3 things that attracts you to the opposite sex. What do you think they were? No. No. Sorry?
Eyes.
Very good. That was number 1.
Yeah.
Number 1 was the eyes. Yeah. People look at the eyes. People don't care about what suit, dress you're wearing. Those days are gone. Number 2 was the smile. Number 3 is your physical attributes. So the smile, I call it as an accessory. It's like jewelry. You know, you can spend, $20,000, $30,000 on a car or $40,000, and it'll last you 5 years. You get a nice smile, it's going to last you 30, 40, 50 years. So how can you equate? People say, gee, that's expensive. Sure. But look how long it's going to last compared to some of the other things you spend on. So it's a value system. So definitely having a nice smile and being attractive will get you opportunities, put it this way. And then it's up to you to prove yourself. This was a very interesting lady. This was actually a lot more complicated case than it looks like, but this lady came in looking like this, and I made her look like that. She wanted very white teeth. This was too white for me, but she wanted it. This was such an interesting case that this tooth was periodontally or had gum disease. While I did a bridge for her starting from here to here, I actually took this tooth out while I was doing the work. I actually did a bone graft, because when you take a tooth out, you have a socket. And if you don't do anything with that socket, it collapses. You will not get symmetry of gum tissue. So if you have a tooth, you take the tooth out, the bone collapses. It doesn't look good. So when I took the tooth out, I did a bone graft, stitched her up, and so I was able to keep the bone level the same. And 2 weeks later, this is what she looks like. So you can see the gingival symmetry, the shape of the gums, all the things that I talk about. I was able to do that. This is another lady. She actually didn't have very nice teeth. And I have to be careful how I address it. And she was actually happy and content till I mentioned it to her and showed her some pictures. This is what she used to look like, and that's what she looks like now. And sometimes you look at people that have crowns, you see dark lines and edges and stuff. You'll never see that on my work, and there's a reason for it. Okay, a little bit of humor. Why do men die young? He's getting a shave and he's too busy looking out. Nice lady, bad Porsche. He's going to get his head cut off. Somebody's not going to have a head. Yeah. So why do men die young? Okay. What I'm going to be talking about is whitening right now. So these are the three things I'm going to cover. Who is it for? How does it work? And the different types. So who is it for? It's for anybody that has permanent teeth that wants to look good and feel good. The criteria is permanent teeth. Now, I can have a 17-year-old come to me and say they want to whiten their teeth. I won't do it. They have permanent teeth. Why I won't do it is because their nerve tissue is very large and it's close to the surface. Sometimes, very rare, but I still won't do it, they can end up needing a root canal as a result of the whitening. So my guideline is around 2021. I won't do 13, 14, 15-year-olds. Everybody has permanent teeth by the age of 12, 13, but I will not do it on. So it's for anybody that has permanent teeth that wants to look good and feel good. Okay, how does whitening work? This is very important. Most whitening products contain a modified form of hydrogen peroxide, and it comes in different concentrations, and it is time and dose dependent. Now that's very important, time and dose. So what do I mean by that? If you increase the dose of a whitening product, it takes less time to whiten your teeth. If you decrease the dose, it takes longer time to whiten your teeth. But guess what? At the end, the result is the same. People don't understand that. So if you increase the dose, the chance of you having sensitive teeth are high. If you decrease the dose, it takes longer, but no sensitivity. So it's very important. You can get products that are 6% hydrogen peroxide, 12%, 22%, 38%. So you really have to look at the age of the patient. You have to look at if they've got gum recession and a whole bunch of other factors. Do they grind their teeth? Are they worn down? You know, and then decide on what's good for them. Okay? And the peroxide breaks down and releases oxygen, which acts as a solvent that initiates the whitening process. It starts the whitening process. But deeper penetration by bleaching agents cause the breakdown of unsaturated double bonds of the chromophores, which inhibit its ability to hold color. So that's a lot of chemical stuff. Why do leaves have green color? Because they absorb, their chromophores absorb the sunlight and give the color green. Teeth have chromophores. So if you destroy the chromophores, it loses its ability to hold the yellow color and the tooth turns whiter. Okay, so that's the best way I can explain it. So the product that I use, and I'll get to it, what I do with the whitening. There are three types of whitening: over-the-counter products, take-home whitening, and in-office whitening. Over-the-counter products, there's tons of them on the market. There's the Crest strips, Colgate toothpaste, Crest toothpaste. They've even got mouthwashes with whitening products in it. So what's the advantage of the over-the-counter products? If you've got a date, you're going out for dinner, you got a wedding coming up, if you use the over-the-counter products, they'll whiten your teeth 2 to 3 shades maximum. So the advantage is it's cheap and it's easy to use. What's the disadvantage? Is the minute you stop using it, it goes back. So it's very temporary. Okay. Now, some people think that you can use these products and it's cheaper, but you'll actually spend more money using these products because you'll keep using it for 2, 3, 4, 5 months and you're nowhere. I don't particularly like them, but each to themselves. The second is the take-home whitening. So with the take-home whitening, you go to the dentist, he takes molds of your teeth and he makes custom trays and he gives you a whitening product. You put it in the trays, you put it in your mouth and your teeth will turn white. So does it work? It works very well. There's a couple of issues. So the advantage of take-home whitening is you will get 4 to 5 shades whiter, for sure, if you do it properly. What's the disadvantage? The disadvantage is compliance. People will not wear the whitening trays for 8 hours a day for 14 days. And the whitening is cumulative. In other words, if you skip day 3 and think that on the 14th day you'll add another day, it's not going to work. It's a cumulative effect. It has to be done every day. So compliance is a big problem. The second problem is sensitivity. You're putting the product on for 8 hours a day, 14 days, and people do get sensitive teeth. So it does work, but you have to pick the patient very carefully with that. You do have, it's not hydrogen peroxide, that's the product that, it's carbamide peroxide and it breaks down into hydrogen peroxide. So the percentages that you'll see is 15% carbamide peroxide, 18%, 22%. So I don't even do this, to be honest, because I can't trust people to do it right, and then they'll come to me and say, hey, it didn't work. So I'm not into that. This is the only type of whitening I do in my office, and it's the in-office. Basically, the patient comes in and it sits in the chair for about 2 hours. We protect their gums with what we call a liquid dam. It protects the gums. We put in a 38% hydrogen peroxide on the teeth, 20 minutes, 4 times. So an hour and 20 minutes. We suction the old product, put new product. We do that 4 times. This will give you 6 to 9 shades whiter in 2 hours, depending on the original color. The more yellow your teeth, the whiter it's going to go. The more gray your teeth or bluish tinge, it will whiten, maybe not 9 shades, but maybe 6 shades. But you will definitely get a fantastic result in 2 hours. What we also do is we give you a touch-up kit. Every patient that night has to wear the touch-up kit, which is like the take-home product, 1 hour a day for 5 days. And that augments what we did. And my results are very, very good, and you'll see it. So the in-office whitening is the only whitening I do. The advantage is you get a greater depth of whitening, longer lasting. The disadvantage is the cost. It's not that much more than the take-home. It just works very well. So people ask me, how long does the whitening last? Off the record, it lasts forever. Why? Because the way I do it. Every time the patient comes in 6 months, when their teeth are cleaned, we instruct them to whiten their teeth for 2 days, 1 hour a day. So when your teeth are clean, the touch-up kit works very well. So it just maintains the whiteness. So people say, oh no, it's not going to last. I don't care how much coffee, red wine, tea you drink. If you just follow the instructions, it works very well. Okay, so there's the in-office whitening. She gave me permission. This is actually Marcia McMillan from CTV, the anchor woman. That's her teeth. Now, this is a bridge to answer your question. I never do any front work teeth, without whitening. So you can see the bottom here. So we did whitening plus a bridge. Lost his keys. He's trying to get in through the cat. Okay. So this is kind of fun stuff. I showed you this case before. The problem was worn, missing teeth. Solution was crown, veneers, and porcelain fillings. So this is before. These are the implants that I placed, and you won't be able to tell even. So this is the veneers on the lower teeth, the crowns on the top teeth. So veneers on the bottom, crowns on the top, implants here, and there's an implant right here. There's the implant right there. So that's the end result. That's case 2. She was not happy with the color and shape of teeth. So that's her right side, that's her left side. That's her front. This lady was not happy with the color and shape as well, and we did crowns. You were talking about crowding. There's some crowding there. The teeth are twisted and everything, and I made them straight. color of teeth, just simple whitening. This is what a bridge looks like. So I worked on from here to here. They were narrow teeth. This patient was told to get an implant. That would have been a big mistake because the tooth would have been too wide compared to everything. So I was able to make this larger, this larger. I proportionalized everything, and look at it.
So you do a lot of retired hockey athletes
Yeah.
and people who get hurt.
Boxers.
Well, in car accidents.
Yeah, yeah, yeah. I just had one actually a couple of days ago. So that's before and after. This one, this lady was something. She's only 21, and she came in looking like this. I did 10 veneers on her, and it was very expensive. I don't know where she got the money, but anyway. I was shocked. I mean, I asked her a dumb question, and that was, do you want to look good, great, or stunning? How dumb is that? She said stunning. So that determined what I was going to do. So she said stunning, and
You were stunned.
I was, yeah. This gentleman's from Toronto, worn teeth, yellow teeth. I did veneers and whiten. That's him before and after. Worn teeth from too much brushing hard, so I did veneers to get rid of that. This lady was an interesting case. Her actually side teeth are missing. These are her eye teeth, and somebody did bonding. So her side teeth are congenitally missing. So I did a mock-up to show her what we can look like, and I actually changed the shape of her eye teeth to make it look like the lateral incisors, and made the premolars look like an eye tooth. So she actually looks like normal now. I've treated a lot of famous people, and these are some of them. Russell Peters, yeah. Actually, I've met a lot. That's Sarah Palin, Trudeau. Yeah, I've for the UFC, I was the dentist on one of their staff. Curtis Joseph, Wendell. Last year, I looked after Oprah. Yeah, and that's a very famous chef, Lydia.
Oh, yeah, I know this. That's the TV show.
Whoever, Bare Naked Ladies, that's Steve Page, the lead singer.
The guy from Sopranos.
Doug Gilmour is my patient as well. That's my wife and my kids. Okay, any questions?
To ask you, our grandson, he was born without eye teeth.
Mm-hmm.
What would you suggest for him? He's only 11, now.
Without the eye teeth?
Yes.
Are you sure he was born without it? They could be impacted, and that's usually the case. And it's not difficult to bring them.
Yeah?
Yeah, you have to take a proper picture, and I can almost guarantee you that they're impacted. It's very rare to not have eye teeth.
Oh, because our daughter, she was born too without, and then her son is.
Yeah, it's hard for me to comment without seeing the case, but I can almost guarantee you that I have a very good oral surgeon friend that can actually expose the teeth and then just hook them and bring them down. Yeah.
What city are you at?
Actually, I used to be in Oakville, Hamilton. I'm in the town of Ayr. Ayr is a very picturesque town near Paris, Ontario, and I also practice in Oakville. So I used to be in Oakville for 21 years. I sold the practice, but I do work with a friend of mine in Oakville on Tuesdays, but the rest of the days I'm in Ayr, which is just past Brantford. Smile.
Smile, there you go.
Hold up the one.
The vitamin C. Thank you very much.
Niagara the best.
Thank you very
all right?
much. Thank you very much. Thank you.